Thank you, Speaker. Colleagues, I rise today to speak to Bill S-204, an act to establish a national framework on heart failure. I applaud the advocacy of my respected colleague, Senator Martin, in bringing this bill forward. Thank you. Colleagues, heart failure is now recognized as one of the fastest growing cardiovascular conditions both in Canada and globally, affecting more than 100,000 Canadians each year. As a clinician, every day brought encounters with patients whose lives were fundamentally altered by this chronic, progressive, and all too often misunderstood condition. I always dreaded holidays like Christmas and Thanksgiving, when many of my patients would imbibe in a traditionally high-salt festive meal that would trigger heart failure. They'd arrive in the emergency room, short of breath, and stoically and with a guilty plea to, "Yes, boy, doc, I've done it again. Please get the fluid off me chest." Despite the advances in understanding and management, heart failure remains one of the top 5 causes of hospitalization in Canada and represents the second leading cause of death. It is a condition that requires not just urgent attention in moments of crisis, but sustained multidisciplinary care. Yet, the needs of patients with heart failure are unique, encompassing not just medical therapy, but also support for mental health, social stability, and often home-based care. I want to emphasize that heart failure is not the end of the road, but a turning point. For many, a timely diagnosis and access to evidence-based care, medication, and support networks can restore both the quality and quantity of life. However, these resources are not always available equally to all Canadians. Too many patients still face barriers to accessing the best therapies available due to cost, geography, or just a lack of public awareness. Despite our universal healthcare ideals, prescription drugs critical for heart failure are not universally covered, with 1 in 6 Canadians with heart disease in 2016 reporting going without necessary medications due to cost barriers. This gap not only results in otherwise preventable hospitalizations and deaths, but also places considerable strain on both families and our healthcare system. As a clinician, it was frustrating to see patients readmitted to hospitals simply because they could not afford the medications that they needed to keep them stable at home. The need for action has never been more urgent. Senator Martin's consideration of this bill to establish a national framework on heart failure marks a pivotal step forward. A national framework can define standards of care so that every Canadian receives best-in-class treatment regardless of postal code. It can support comprehensive patient education, foster research into emerging therapies, and strengthen the role of patient organizations and caregivers in the management of heart failure. I commend the Senate for prioritizing this legislation and urge all of you colleagues to work swiftly and collaboratively for its passage. In addition to equitable access to care and drugs, policy must also invest in prevention, early diagnosis, and rehabilitation, so we do not only treat this disease, but also reduce its incidence and negative impact. Addressing heart failure holistically will ultimately save lives and healthcare dollars alike. In closing, the stories heard every day, from patients who want to live to see their grandchildren grow, to caregivers juggling jobs and home care responsibilities, remind us that behind every policy decision are real people, real families, and real communities. Canada now has an opportunity to lead the way, to commit not only to treating to heart failure, but to preventing it and helping Canadians live their fullest possible lives. Let us seize this moment, colleagues, and fill the gaps, enhance public awareness, and move boldly towards a future where high-quality, accessible heart failure care is the standard for all Canadians. Thank you. Merci. Miigwech.